Zimbabwe has pulled out of negotiations with the United States on a new health deal that was going to see Zimbabwe receiving 350 million in funding over a period of 5 years. As a result of Zimbabwe's actions, the United States has stated that it is officially ending or drastically reducing its health-related aid programs in Zimbabwe. This statement was made by the US Ambassador to Zimbabwe, Pamela Tremont, on the 25th of February 2026, and she said, "We will now turn to the difficult and regrettable task of winding down our health assistance in Zimbabwe." Now, one would think that everything was going so well after Zimbabwe had successfully rolled out the HIV prevention drugs in a program that was massively supported by the United States.
They're waiting to get an injection of the new lenacapavir HIV prevention drug launched in the country on Thursday that only needs to be administered twice a year. The sex worker says she feels relieved after having the jab. With clinical studies demonstrating near total protection, the drug's been described by some health officials as a turning point for high-risk groups. It's being offered for free to people such as sex workers, adolescent girls and young women, gay men, and pregnant and breastfeeding women.
And after all this massive success, in just 1 week, Zimbabwe has pulled out of negotiations with the United States on a new health deal intended to replace the aid program disbanded by the President Donald Trump. The US Embassy in Harare has said this. The US has been striking new health aid agreements across Africa after Trump tore down the long-standing USAID agency and affected the role of NGOs. Let me give you a bit of context about this USAID and why Trump is trying to replace the programs that were removed when he stopped the USAID. Now, the USAID was an agency for international development which used to help a lot of African countries. All these past years, it has been operating as an individual entity, as a single entity or a single agency. But on the 1st of July 2025, it was absorbed into the State Department and it ceased operating as an independent agency. The Trump administration dismantled the agency, terminating thousands of contracts, and by July 2025, it had halted over 80% of the programs. The cuts have led to significant reductions in the US foreign aid, affecting global health programs, disaster relief, and development projects. Now, at first, this deal seemed as if it was a very good deal because it was going to provide over 350 million in funding for all the health-related programs that were going to be run in Zimbabwe. And as you noticed earlier last week, around the 16th of February 2025, Zimbabwe rolled out a successful program where they were injecting people with HIV prevention drugs. But this is the part of the deal that Zimbabwe could just not agree with the United States. There is a part, or there are terms and conditions of this help that America wanted to give Zimbabwe. There are terms and conditions where Zimbabwe has to give America access to the health data of the nation. And also, it was supposed to give the United States of America access to the mineral resources, to the most important mineral resources of Zimbabwe. And these two were just a no for Zimbabwe. And the president of Zimbabwe called out the negotiations and informed the representatives to pull out of the negotiations, as he stated that this deal undermines the sovereignty of Zimbabwe. The US Embassy confirmed in a statement that Zimbabwe had pulled out of the negotiations, and their statement said, "We believe this collaboration would have delivered extraordinary benefits for Zimbabwean communities, especially the 1.2 million men, women, and children currently receiving HIV treatment through the US-supported programs." This is what the Ambassador, Pamela Tremont, was quoted saying. "We will now turn to the difficult and regrettable task of winding down our health assistance in Zimbabwe." But then if you are coming to Zimbabwe and you are trying to assist by providing all these health related programs, why then are you asking for access to the minerals of the nation? And why are you asking the health data of the nation? If you just want to provide, just provide without asking all these questions or the access to all this information. Because Another thing, this request has been rejected because of fear that the US intelligence will use it to get more intel on the Zimbabwean nation. And this is just not how it works. And for this one, we need to give a round of applause to the leadership of the nation, to the people involved in this who managed to stand up and say, even if we might want your help, even if we might want this deal that will provide us 350 million in funding, we will not give you this information because it defeats the sovereignty of the nation. So let me know, guys, was this the right decision that the president of Zimbabwe made? Are we going to regret it or are we not? Did he make the proper decision of rejecting the negotiations? And if not, you can let me know what you think in the comment section. But this is the information that we have. If you want to stay updated about this, we'll keep tracking it. So please subscribe to this channel so that you don't get to miss any updates about this particular case. But until next time, it is goodbye for now.